If you're over 60, chances are you felt this before. You wake up in the morning, your body still works, but it doesn't feel as smooth as it used to. Your heart beats a little faster when you climb a few stairs. Your eyes get tired more quickly when reading small print. Your knees feel stiff when you stand up from a chair. And sometimes you forget a familiar name and quietly wonder to yourself, is this just what aging feels like? Many people I meet in my clinic believe that after 60, decline is unavoidable. If you want to stay healthy, you probably need more medication. But as a doctor who has passed the age of 60 myself and who has cared for older adults for decades, I want to tell you something important. Your body is not broken. It's responding to how you nourish it every single day. Aging doesn't arrive all at once. It doesn't happen in one big collapse. It comes through small, quiet changes, slowly building up in your blood vessels, your joints, your brain, and your digestive system. And because of that, the small choices you make every day matter far more than you realize. Today, I want to talk to you about a very familiar food. Not a drug, not an expensive supplement, not anything new or exotic. Something that's been sitting in your kitchen for decades. Something many people eat, but very few eat the right way after the age of 60. We're not just going to ask, is it healthy? Instead, we're going to ask, what actually happens inside your body when you eat it regularly after 60? When does it make your heart's job easier? When does it better support your eyes, your brain, and your joints? And most importantly, when can it become a burden on the stomach, kidneys, or joints for some older adults? My name is Dr. David Warren. I'm not here to promise miracles. I'm here to help you understand your body better, so every daily food choice becomes a smart, safe decision that fits your age. If you're ready, let's begin with the first system that clearly changes after 60 and how a familiar food can influence it. Point 1. Heart health after 60, not suddenly weak, just more sensitive to every meal. After the age of 60, your heart never stops working, but the way it works does change. Your blood vessels are no longer as flexible as before. The inner lining of your arteries becomes more fragile. Bad cholesterol sticks around longer, and blood pressure can rise quietly, even when you still feel okay. Here's the key thing to understand. An aging heart does not like shocks. It doesn't like overly salty meals. It doesn't like repeated hits of unhealthy fats. It doesn't like foods that trigger long-term inflammation. What it needs is consistency and gentleness. And this is where a familiar food plays its role. Not like medicine, but like a quiet helper for your blood vessels. Simple science explained clearly. This food contains natural antioxidants that help reduce oxidation of bad cholesterol, support elasticity in blood vessel walls, improve smoother blood flow. It also provides minerals that help regulate blood pressure, so your heart doesn't have to strain every day. This doesn't change things overnight, but after weeks and months, the body begins to respond. Real-life benefits I've seen. Many older patients who gently adjusted their daily meals noticed less dizziness when standing up, fewer unexplained palpitations or fatigue, more stable morning blood pressure, a calmer, steadier heartbeat during light activity. Not because they stopped their medication, but because their food stopped adding extra stress to the heart. Practical guidance. If you want to support your heart after 60 using this food, remember 4 things. 1. Choose lightly cooked forms, soups, gentle stews, or quick sautéing with a small amount of healthy oil. Make it easier to absorb and gentler on the stomach. 2. Pair it with healthy fats. A spoon of olive oil, fish oil, or natural fats from fish help the heart protective compounds work better. 3. Avoid excess salt. Too much salt cancels out blood pressure benefits. Use onions, garlic, ginger, and herbs for flavor instead. 4. Moderation matters. 1 to 2 small servings per day is enough. For heart health, consistency matters far more than quantity. My personal advice as a doctor, if you're over 60 and you have high blood pressure, elevated cholesterol, or a family history of heart disease, don't wait for clear symptoms before making changes. The heart doesn't complain early. It just gets tired slowly. Think of every gentle meal as giving your heart a moment to rest. Point 2. Vision after 60. Your eyes aren't failing. They're undernourished. Many people over 60 say this to me quietly. Doctor, my eyes get tired so quickly. Reading small print gives me headaches. Car lights at night feel blinding. And then they quickly conclude, it's just old age. But here's the truth. Your eyes don't stop working after 60. They simply become more sensitive to what you put into your body every day. Simple science: after 60, the eyes go through 3 quiet changes. Reduced blood flow to the retina, weaker antioxidant protection, slower cellular repair. Without proper nourishment, eye cells become more vulnerable to bright light, natural aging, long-term low-grade inflammation. Certain familiar foods contain nutrients that help protect the eye surface, maintain natural moisture, reduce oxidative stress in the retina. They don't make your eyes young again, but they help them age more comfortably and more slowly. Real-life benefits. With consistent eye-supporting nutrition, many seniors notice less eye fatigue when reading, less squinting while watching TV, reduced dryness by evening, greater confidence walking outdoors, especially at night. Because vision isn't just about seeing clearly, it's about staying independent. Clear vision helps you walk safely, read medication labels correctly, recognize loved ones, stay less dependent on others. Practical guidance. To care for your eyes after 60, 1. Eat it with regular meals. Avoid eating it alone on an empty stomach. Meals improve absorption and reduce digestive discomfort. 2. Avoid eating late at night. Digestion and circulation slow in the evening. Late meals can worsen reflux and indirectly strain the eyes. Supre. 3. Combine with dark leafy greens. No single food can nourish the eyes alone. Variety matters. 4. Stay hydrated. Dry eyes are often a sign of mild long-term dehydration. My advice as a doctor: if you've started avoiding night driving, losing interest in reading, feeling uncomfortable with bright light, don't accept that as fate. Start with small, consistent changes in how you eat and live. Your eyes have served you for more than half your life. They deserve patience and gentle care in the years ahead. Point 3. Memory and mental clarity after 60. The issue isn't a weak brain, it's the daily environment you give it. Many people over 60 carry a quiet fear they rarely say out loud. I've been forgetting things lately. Words disappear while I'm speaking. Sometimes I walk into a room and forget why. Then comes the deeper fear. Is something wrong? Am I becoming a burden to my family? As a doctor, I want you to know this. Your brain does not shut down after 60, but it becomes far more sensitive to inflammation, reduced blood flow, and long-term stress. Simple science. After 60, the brain faces 3 pressures at once: reduced circulation, chronic low-grade inflammation, slower nerve cell repair. When inflammation lingers, signals travel more slowly. When blood flow is inconsistent, focus and memory suffer. Certain familiar foods help protect brain cells from oxidative damage, support blood flow to the brain, calm long-term inflammation. This doesn't bring back a 30-year-old memory, but it helps the brain function more steadily, decline more slowly, and feel calmer. Real-life benefits. When the brain's environment improves, many seniors notice clearer mornings, fewer everyday forgetful moments, better focus during reading or conversation, more stable mood. When the brain is nourished, emotions soften too. People sleep deeper, worry eases, life feels more connected again. Practical guidance. To support your brain after 60, 1. Eat regularly. Don't skip breakfast. The brain is very sensitive to morning energy shortages. 2. Add gentle daily movement. A 15 to 30-minute walk dramatically improves brain circulation. 3. Avoid dietary monotony. No single food can nourish the brain alone. 4. Protect your sleep. Sleep is when the brain clears waste. Good food cannot compensate for poor sleep. My advice as a doctor: if you feel more forgetful, more anxious, less interested in things you once enjoyed, don't blame yourself. Much of this reflects how your body is being nourished each day. Caring for your brain isn't about fighting age. It's about keeping your mind bright enough to enjoy the years ahead. Point 4. Joints after 60. Pain isn't because you're worn out. It's inflammation and quiet undernourishment. There's a familiar moment many seniors recognize. In the morning, the pain isn't severe, but knees feel stiff, the back feels heavy, fingers feel tight, and it takes a few minutes for the body to loosen up. Many people think joint pain is just part of aging. Nothing can be done. But the truth is, your joints aren't just aging. They're reacting to long-term inflammation and poor nourishment. Simple science. After 60, natural anti-inflammatory defenses decline. Joint lubrication decreases, tissue repair slows. When inflammation lingers, morning stiffness increases, weather affects pain. More. Recovery after movement takes longer. Certain foods help reduce low-grade inflammation, improve circulation to joints, support bone and connective tissue nourishment. They don't erase pain overnight, but they make joints easier to live with. Real-life benefits with better inflammation control, many seniors experience. Less morning stiffness, more confident movement, easier standing and sitting, less dependence on high-dose painkillers because movement equals independence. Practical guidance. To support joints after 60, 1. Eat consistently. Don't overload one meal. Steady nourishment works better than large portions. 2. Move gently every day. Walking, stretching, light joint rotations for 10 to 15 minutes is enough. 3. Stay hydrated. Dehydration dries joints more than people realize. 4. Avoid heavy meals when exhausted. Poor digestion increases inflammation. My advice as a doctor: if joint pain is making you withdraw from life, remember this: the less the body is nourished properly, the louder it complains. Joint care isn't about running like you're young. It's about keeping every step steady, confident, and independent as you age. Doi jai laban dichteng anfong kashvan noi tunyendan chongoi. Migujung yong baxiamap rorang de hu. Point 5. Immunity after 60. It doesn't disappear, just slows down and gets tired if you don't support it properly. There's something many older adults feel, but can't always put into words. A cold takes longer to go away than it used to. A small scratch takes days to fully heal. You get tired more easily, even when you haven't done anything heavy. And then people think, my immune system must be getting weak. But the truth is, your immune system doesn't vanish after 60. It's just working more slowly. And it's more easily exhausted after decades of protecting you. Simple science explained clearly. As we get older, immune cells respond more slowly. The body's ability to repair damage decreases, and it becomes easier to slip into long-term, low-grade inflammation. If you're not getting enough antioxidant-rich nutrients, your immune system is forced to work under poor conditions. It's like a security team, but without flashlights and protective gear. Certain familiar foods can provide antioxidants that help protect your cells, micronutrients that help immune cells work more efficiently, a healthier internal environment for the body to repair itself. Real-life benefits. When immunity is supported better, many seniors notice fewer minor illnesses, deeper, better sleep, more stable energy throughout the day, more peace of mind, less constant worry about getting sick. Because strong immunity isn't just getting sick less. It also means less fear, less anxiety when the weather changes, less stress about hospitals, medications, and complications. Practical guidance. To support immunity safely after 60, 1. Eat antioxidant-rich foods consistently. You don't need a lot. You need it regularly. 2. Don't skip meals when you're tired. When you're tired, your body needs nutrients even more to recover. 3. Prioritize deep sleep. Lack of sleep weakens immunity faster than any food can make up for. 4. Keep your stress steady. Long-term stress can seriously weaken immune function. My personal advice as a doctor: if you often worry about illness, remember this: your body is still trying to protect you every single day. Your job isn't to force it to work harder. Your job is to give it better conditions. so it can work more effectively. Point 6. After 60, healthy isn't enough. Eating the wrong way can make the body react in the opposite direction. There's a very common misunderstanding I see in older patients. If a food is healthy, then the more you eat, the better. But after 60, that's no longer true. When you're younger, your stomach is stronger, your kidneys are stronger, and your body can handle more things at once. But as you get older, your body becomes more sensitive to small details. When you eat, how you cook it, how much you have, and what health conditions you already live with. Even a healthy food, when used the wrong way, can still cause discomfort. Simple science. After 60, stomach acid becomes more unpredictable. The valve between the stomach and esophagus can weaken, making reflux easier. Kidneys filter more slowly. Joints can become sensitive to certain natural compounds. So for some people, eating the wrong way may lead to chest burning or reflux, bloating, and indigestion, slightly increased joint discomfort, unexplained fatigue. That doesn't mean the food is bad. It simply means your body needs a different approach than it did at 30 or 40. Real-life benefits of eating it the right way. When older adults adjust how they eat, their stomach feels lighter, sleep improves, less heartburn and less nighttime coughing. Joints feel easier in the morning, and most importantly, they no longer feel that anxiety after eating. Eating in older age should bring peace, not worry. Practical guidance, very important. If you're over 60, remember these 6 principles. 1. Choose lightly cooked versions. Soups, stews, and quick sautéing are often easier to digest and less irritating. 2. Don't eat it on an empty stomach that can trigger reflux or stomach discomfort. 3. Avoid heavy portions at night, especially if you deal with reflux, nighttime coughing, or poor sleep. 4. Keep portions moderate. 1 to 2 small servings per day is enough. Your body prefers steady consistency, not overload. 5. Pair it with healthy fats. A little olive oil, fish, or nuts can improve absorption and make it gentler on the stomach. 6. Listen to your body. If you notice the same discomfort repeatedly, stop and speak with your doctor. My personal advice as a doctor: after 60, eating is no longer just getting enough nutrients. It's about eating in a way that makes your body feel respected. No single food fits everyone. Smart people don't eat based on hype. They eat based on how their own body responds. Aging doesn't need to be perfect. It just needs to be cared for the right way. Before we finish, I want you to pause and look back on your own journey. You've lived through many seasons of life. This body has worked tirelessly to carry you to this moment. After 60, your body doesn't ask for complicated things. It simply needs food that's prepared the right way, gentle, consistent movement, to be listened to, not forced. A familiar food, when understood and used correctly, can help your heart work with less strain, help your eyes feel less dry and less tired, support your brain and emotional steadiness, calm the inflammation that affects your joints, strengthen your defenses so your body can protect itself better. But the most important thing I want you to remember is this: there is no miracle food. There are only small choices, repeated daily, that quietly create big change. As a doctor who has passed the age of 60, I don't need you to live longer than everyone else. I simply want you to hurt less, worry less, depend less, and enjoy the years ahead with more peace in your heart. If this video gave you a new perspective, and if you want to keep learning how to care for your body in a way that truly fits the rhythm of aging, please subscribe and stay with me for the next videos. We don't fight aging. We learn how to live in harmony with it. Disclaimer: this video is for educational purposes only and does not replace personalized medical advice.